is Jana and I'm gonna be presenting hip joint today. Here is my audience, Engin Jugder and Veronika Kuzholova.
Hello.
We are all from Czech Republic, so sorry for our accents. So the hip joint is the joint between the femur and the acetabulum of the pelvis. The main function is that it supports the weight of the body in both static and dynamic. So static is standing and dynamic is walking, jumping, running, movement. Then other functions is obviously movement and balance. This is how the hip looks like. The hip is a synovial joint. It's formed by the articulation of the rounded area of the head of femur and the cup-like acetabulum of the pelvis. The lower lateral border of the sacrum and the ischial tuberosity. So here, and it's the primary connection between the bones and the lower limb and the axial skeleton. So it's the mid of the body. This is the femoral head, and this is the cup-like acetabulum, and both surfaces are covered with strong but lubricated layer, and it's called articular hyaline cartilage. There can be different angles of the femoral neck. The angle in newborns is around 150, and then it's formed, and when we are adults it should be around 126. If the angle is smaller, it's called coxavara. If the angle is larger than the normal, it's called coxavalga. So you can see the angles there, and because of the different angles, it also affects the knee because it's the angle of the femur. Okay, there are three major ligaments: iliofemoral, ischiofemoral, and pubofemoral. It attaches the bones of the pelvis with the leg. So iliofemoral is with ilium, ischiofemoral goes from ischium, and pubofemoral from pubis. The functions of those are, all of them strengthens the capsule, and it prevents of an excessive range of movement in the joint, and it basically prevents the hip from dislocation. In the sitting position, they become relaxed, and in extension, that's when they are extended and stretched. Our movements and muscles. So with the hip joint, the same as shoulder joint, they are the two most movable joints in the body. They do all 6 movements possible. So they do external rotation, internal rotation, extension and flexion, and also adduction and abduction. Muscles responsible for flexion, I just put a major one there. So for flexion, it's rectus femoris, iliopsoas, pectineus, and TFL. For extension, it's gluteus maximus, bicep femoris, semitendinosus, and semimembranosus, so basically hamstrings. And for hip abduction, it's gluteus maximus and medius. The medius because it's lateral, the fibers there, and TFL. And hip adductors are adductor magnus, longus, and brevis. And for hip external rotation, it's gluteus maximus and piriformis, and for internal rotation, it's TFL. So this one. Sexual difference. The hips in females and males are different because they are in females they are widened during puberty. It's different because females are giving birth to a child, so they are wider to make a space for the baby, and they are also a little bit tilted forward. So that's the difference in males and females. Starts in puberty. Injuries. There is five common injuries. It's a hip fracture. It could happen at any age really. If some accidents happen, like car accidents, bikes or something, but it would have to be a really strong force to break the femur. But it's more common with older people because the age, obviously they use them so much more, and because older people usually have osteoporosis. Another could be bursitis, and that's swelling and inflammation of the fluid-filled sacs. Another one, because it's a joint, it could be dislocation, and again would be a really strong force on the hip. The shoulder pops way more than hips. Like dislocated hips, it would take a really strong accident, and it's basically when it slips out of the socket. Another one is labral tear, and it's damage to the cartilage. It's something I am familiar with because I have something similar, and it really hurts, and that's when the bone actually doesn't really fit and this cartilage is all broken. So when the bone hits it, it actually hurts, and the cartilage is not smooth and it hurts. And the last one is snapping hip syndrome. It happens when the hip is extended. It doesn't have to make any noise or anything, and it just snaps, and it's also very painful. And that's how the hip fracture looks like. I guess really painful also. Okay, so that's all from the hip, and now I have a quiz for you guys.
No!
Who wins gets a special prize. I know both of you like it. So, try. Okay, so it's gonna be just 5 questions. Who answers more wins. Easy. So the first one is, why is the hip different in males and females? Okay, anything got it first?
Because the females, they give birth to children.
Okay, and
Is it right?
yeah. And do you know something else too?
And it widens during their puberty.
Yeah,
in
good,
females.
good.
Yes.
Okay, so engine has point number 1. What are the functions of the ligaments? Okay. Okay, go for it. Just
They prevent an excessive range of movements.
good. Yeah, that's their main function. So strengthens the hip so it doesn't pop out, dislocation. Good job, Veronica. So it's 1-1. Yeah, and it also prevents the tilt from throwing, which is the same thing basically. Why is hip fracture more common with older people? Okay.
Because, they are older, so they used it longer than the young people.
Yeah.
And they have osteoporosis as well.
Good.
So that's the reason why.
Good. Most of them, not all of them, but very good. Okay, the other one is, what are the functions of the joint? Yeah?
It supports the weight of the body, then balance and movement.
Good. Wow, 2-2. Okay, so the last one. Let's see. Okay, good answers. And let's see the last one. What are all the movements of the joint? Okay. Okay, well, she was first, so try, and then...
It's flexion, extension, abduction, and...
You know?
Adduction.
Yeah.
And internal and external rotation.
Okay, guys, but now it's tied.
Oh,
Okay, so let's improvise and let's show me. You guys both stand up if you can. Can you stand up?
Oh no, my hips really hurt. No, just
Okay. Okay, I'm gonna quiz you. Okay, can you do flexion of a hip? Yeah, good. Okay, can you do abduction?
abduction. When you abduct people, you take them away. So like this.
Yeah, good. Okay, can you do external rotation?
Like this?
Yeah, good. Okay, you do internal rotation.
Like this.
Okay, and now you do extension.
Extension. Like this.
No, can you do extension?
No, it's like this. Like backwards.
Okay, good. And can you do also adduction?
Abduction is...
Okay, so Veronica wins because Don't worry, I'm sure she will share for you when you guys live together.
No.
Extension is actually
Congratulations.
backwards.
Thank you.
Extension forward would be of a knee if you kick. But good job, guys. Oh yeah, here is your prize,
Thank you.
Nutella. Okay, well.
Show it.
Guys, thank you for coming. I hope you guys learned something. And thank you for paying attention. And that's all for today.